Welcome to Dysfunctions that make you go, Which dysfunction do you look for when you do the arm elevation test with your clients? We at Syzygy believe that the scapular mechanics can reveal a lot of different problems in different parts of the body. So we would like to invite you to join us in exploring 5 very common dysfunctions that we can see in people. Let's take a look at the arm elevation test with our client Sarah. If you take a look at the scapulas of Sarah, you can just look at my fingers to follow the scapular motion. As she starts to go up with her arms, you can see that her left scapula moves way more than the right one. So we can say the right one is more stuck. As she goes higher with her arms, you can also see that the right trapezius is tensing up and that the angle of the right humerus is different than the one of the left one. You can also see that the right elbow is more bent in this position. In this video, we're going to talk about problems with the rotation or reduced head rotation, which is one of the mentioned 5 common dysfunctions that we can find. So first, I'm going to explain a little bit the mechanics of the shoulder motion, and then we're going to go into the mechanics of the head rotation, and then maybe you can see why this is influenced by the mechanics of the scapula. First muscle, the serratus, huge muscle, comes from the medial border of the scapula and inserts into the ribs. It's there to externally rotate your scapula. The second one are the rhomboids, which basically are a continuation of the serratus. It's 2 of them. They come from the 7th cervical spine up until the 5th T-spine. So it's like this. They do basically the opposite. They pull the scapula towards the spine. Then from there, the continuation are the splenic muscles that come from the 7th cervical spine down until the 3rd. And they go up until the masstoid process on the other side. So it's basically like a sling from the head of one side up down until the ribs of the other side. And as mentioned in the video where we talk about neck pain, we have the trapezius, the upper portion, which comes from the head area on the back down to the spine of the scapula, the clavicle, the acromion, so it's here. And as mentioned before, if we have a problem in this sling, we have also a problem with all the muscles that insert from the scapula, which are the trapezius muscles that go to the head, the rhomboids, and the splenic muscles. So all of them are influenced if the scapular motion is not as it's supposed to be. So we get tension here. So for example, we have the rhomboids that are very tight. So as we know, biomechanically speaking, for head rotation, I also need the top 4 T-spine to rotate. So if this is stuck, this one is less mobile and this causes problem with the rotation. Then, as a compensation of this, the splenic muscles get tight. So they influence the rotation because they can't function as a rotator or they inhibit a rotation. And on top of that, as mentioned, the trapezius, which is getting tight because it's trying to help with the elevation, is also a very important rotator. So we have problems from the scapula going up with tightness and also lack of mobility of the upper T-spine, the lower cervical spine, which can cause a reduced range of motion in the head, which is, as we believe, a major cause of not optimal mechanics of the scapula and not the head or the cervical muscles itself. So if you find this video helpful, please take a look at our website and we invite you to try and test this with your clients and if you can see the same problems or dysfunctions that we see with our clients. Thank you.